Hi, my name is Dr. Dana Wasserman, and this is Tough Talk with Dr. Dana. Today's tough topic is personality disorders, which is surely a tough topic for many who have lived with or who continue to live with a personality disorder. But first, please read the disclaimer and listen carefully to these important words. I'm legally required to tell you that I'm not providing any psychological services and that this isn't intended to treat, diagnose, or cure any psychological issues you may have. I will be sure to honor your questions so that if necessary, you will better know when to seek help. Thank you. So today we are going to talk about personality disorders. First, I'm going to explain exactly what personality disorders are. Next, I'm going to explain the effects of personality disorders. Then I'm going to describe the 10 personality disorders. I'll discuss possible causes of personality disorders. And lastly, I'm going to examine treatment options for personality disorders. All of this within 15 to 20 minutes. Let us commence. Before I describe what a personality disorder is, let us begin by defining what a personality is. According to the most recent DSM-5, and that stands for the Diagnostic and Statistical Manual of Mental Disorders, it defines personality traits as, quote, enduring patterns of perceiving, relating to, and thinking about the environment and oneself that are exhibited in a wide range of social and personal contexts. That is, it is an amalgam of one's thoughts, emotions, and behavior, and how these interface with the world. We have all heard the term personality bandied about frequently. For example, let's say you hear a particular person has a, quote, aggressive personality. Well, what does this imply? Well, this might imply that this person behaves in an overall aggressive fashion and more than likely thinks, that is, his or her cognition, in a way that is aggressive. And so too are his or her emotions expressed in an aggressive manner. So we can understand personality as how we are observed to interact with the world through cognition, emotions, and behaviors. Our personalities are all incredibly individual and specific, differing wildly by way of genetics, that is, our inherited characteristics, and our environment, both our physical environment and our life experiences. So, what then is a personality disorder? This is a type of mental health disorder, a mental illness, if you will, in which one possesses a rigidly unhealthy way of thinking, behaving, feeling, and most of all, functioning. People with personality disorders struggle with understanding as well as relating to people and situations. And all of this can cause problems and limitations in relationships, at work, school, and social activities, all in different permutations. According to the American Psychiatric Association, personality disorders are, quote, long-term patterns of behavior and inner experiences that differs significantly from what is expected. And interestingly, many people do not realize they have a personality disorder to begin with. Because think about it, the way we think and feel and behave seems very natural to us. This is also called egosyntonic. That is, for something to be egosyntonic, behaviors and values and emotions are in line with the needs of the self. Other personality disorders are more ego-dystonic, that is, one's behaviors and values and emotions are in conflict with needs of the self, causing an internal dissatisfaction and turmoil. Personality disorders are uncommonly diagnosed under the age of 18. Why? Because one's personality is still developing. And if a personality is diagnosed under the age of 18, those particular personality traits have to exist for at least a year. And yet, still by that point, it is still uncommon to have that particular diagnosis. However, there is an exception that I'll discuss later in the talk. It is thought that the disordered patterns of behavior and emotions manifest around late adolescence, which is ages 18, 19, and one may notice problems in functioning during this time. These disorders affect at least two of the four following areas, and here they are: cognition, how we think about ourselves and others; affectivity, how we respond emotionally; interpersonal functioning, how we relate to other people; and impulse control, how we control our behavior. So, in terms of the 10 personality disorders, they are separated into 3 clusters, and they're called clusters A, B, and C. And they are based on the similarity of symptoms and characteristics. One does not need all of the elements of a personality disorder in order to live with one. So let's go over the 10 personality disorders by cluster so we can understand how they are defined as well as how they are grouped together. Let's start with cluster A. Cluster A personality disorders are defined by eccentric and strange thinking and/or behavior. They include paranoid personality disorder, schizoid personality disorder, and schizotypal personality disorder. We'll start with paranoid personality disorder. People with paranoid personality disorder have an overall distrust of people and their motives, and they are persistent in the belief that people will harm or deceive them. They typically don't have close relationships as they don't trust to confide in others. They perceive innocent remarks or situations as a personal affront, and they will take an angry offense. They tend to hold grudges, and if the person has a partner, he or she is perpetually convinced that said partner is unfaithful. Next, it's schizoid personality disorder. People who live with schizoid personality disorder prefer, frankly, to be completely alone, as they simply have no interest in any kind of relationship, in terms of a friend, in terms of a partner. The way they emotionally express themselves is extremely limited. There is a lack of an ability to enjoy most activities, as well as a relative inability to pick up on most basic social cues. They come off to others as being cold and indifferent. Next is schizotypal personality disorder. Now, this one's really interesting, and I'll tell you why. People with schizotypal personality disorder have distorted thinking and eccentric behavior. Their beliefs, behavior, and speech and mode of dress are typically odd. They may have strange perceptual experiences, such as hearing whispers that don't think that come from within them. They may engage in magical thinking, that is, your thoughts can power change in people and events. Akin to this is the belief that messages are being sent to the person via events that are not necessarily related. Now, you may be thinking to yourself, hey, this sounds a lot like psychosis, and indeed it does. However, psychotic disorders are characterized by a constant stream of psychotic symptoms, such as delusions and hallucinations, not sort of these ephemeral blips of a whisper or ideas of reference rather than fixed delusions of reference. People with schizotypal personality disorder tend to have much social anxiety and struggle with relationships. Their emotional responses are either flat or totally inappropriate. Their responses to people range from indifference, inappropriate, to suspicious. And that's cluster A. Next, we'll do cluster B. Cluster B personality disorders are characterized by thinking and behavior that is unpredictable, dramatic, and highly emotionally charged. We'll start with antisocial personality disorder. People with antisocial personality disorder show blatant disregard for others' feelings, as well as the safety for self and others. They may engage in a constant stream of lying, stealing, and sneaking, as well as conning others to get their own needs met. They may have run-ins with the law, expressing impulsive, aggressive, and often violent behavior for which there is little to no remorse. Now, when I mentioned before that personality disorders cannot be or can be diagnosed, but very rarely so under the age of 18, antisocial personality disorder is one that cannot be diagnosed under the age of 18, period. In fact, there must be a history of some symptoms of another disorder called conduct disorder, which is, and usually before the age of 15. Conduct disorder involves a repetitive and persistent pattern of behavior that violates the basic rights of others and of other age-appropriate societal norms. So again, for antisocial personality disorder, you can't have a diagnosis under 18, and you have to have a history for age 15 of conduct disorder. Next is histrionic personality disorder. People with histrionic personality disorder seek out attention by acting in a very emotional, dramatic, and provocative fashion. They are usually preoccupied with physical presentation. And though they may express strong opinions with little factual evidence to back them up, they tend to be easily influenced by others. Their emotions are brittle and tend to fluctuate. Lastly, they perceive relationships as being closer than they truly are in reality. Next is one I'm sure you've heard of before, and that is narcissistic personality disorder. People with narcissistic personality disorder believe that they are special and somehow more important than others. They fail to pay attention to others' feelings and needs, and they often take advantage of others, as well as having the expectation of favors. They may fantasize about power, fame, and beauty, and may exaggerate the nature of their own accomplishments and talents. They expect a stream of constant praise and attention and behave in a very arrogant manner. And lastly, for cluster B, is something called borderline personality disorder. And people with borderline personality disorder have a very fragile sense of self that leads to unstable relationships. Their moods fluctuate rather significantly, and they may engage in risky and impulsive behavior, and they may engage in threats or actual acts of self-harm. They tend to live with a profound sense of emptiness, intense fears of abandonment, and may demonstrate strong displays of anger. And these displays of anger are typically when in the face of extreme stress or when they are faced with abandonment. Lastly, we have cluster C. These are personality disorders that are marked by anxiety and fearfulness. We'll start with avoidant personality disorder. People with avoidant personality disorder are extremely shy in all environments. They tend to be socially inhibited and will isolate, avoiding people and activities. Characteristically, they are incredibly sensitive to criticism and rejection and have very poor self-esteem. They fear humiliation, ridicule, and disapproval by others. Next is dependent personality disorder. As the name says, people with dependent personality disorder are extremely dependent on others to get their needs met. In relationships, they may be submissive, perhaps even clingy, and the moment one relationship ends, they are likely to jump into another relationship. They too tend to have very poor self-esteem and will reach out to others for even the smallest of decisions. They tend to struggle with doing things on their own without assistance. Because they so fear the disapproval of others, they are unlikely to speak up and disagree assertively. They tend to tolerate poor treatment from others as they fear standing up for themselves, and they will seek out others for protection. And lastly is obsessive-compulsive personality disorder. I discussed OCPD during my talk on obsessive-compulsive disorder a few weeks ago. While OCD involves the debilitating obsessions and compulsions that we discussed, OCPD revolves more around perfectionism and a preoccupation with detail and orderliness. People with OCPD tend to want to be in control of others and associated tasks, and therefore they are usually completely unable to delegate tasks. They struggle with maintaining relationships because of a need to work on or complete a project, thereby ignoring the needs of others. People with OCPD can be rigid and stubborn, grasping onto ideas about values, morality, and ethics. And in addition, they may struggle to get rid of old objects and treat money in a miserly manner. Now, let's talk about causes and treatment of personality disorders. Well, no one really knows a specific cause or causes of personality disorders. However, according to the Canadian Association of Mental Health, recent research is looking at factors such as genetics, childhood trauma, high reactivity to situations, and peer influences. And if you think about it, this is very logical. They're looking at a genetic predisposition to these personality disorders, but at the same time, they're looking at the elements of one's environment in terms of the development of that personality in that environment. Now, in terms of treatment, personality disorders, frankly, are particularly hard to treat. Now, think about this. With personality disorders, it is not so much the symptom that is causing the distress, but rather a deeply ingrained characteristic. And however, research has shown that there are a few therapies that have proven to be effective at treating them. And I'll give a few examples. The best example is dialectical behavioral therapy, or DBT, developed by psychologist Marsha Linehan. This is the most researched treatment for borderline personality disorder. And interestingly enough, Marsha Linehan herself had come out, I'd say a few years ago, coming out with the fact that she herself has borderline personality disorder. Dialectical behavioral therapy, or DBT, focuses on the validation of one's experience while keeping focus on internal change. This is not to say personalities cannot be treated. No, rather, they take a longer time in therapy if the person with the personality disorder seeks out therapy in the first place. Other therapies being researched for all 10 disorders include cognitive behavioral therapy, which examines and seeks to change maladaptive conscious thoughts and behaviors, and as well, psychodynamic therapy, which very generally examines unconscious processes. Indeed, these therapies are being looked to treat all personality disorders, but this is a task that is still well in progress. And that concludes my talk on personality disorders. So let's see if we have a couple questions here. So we have one. It says, let's take a look. It seems that personality disorders aren't talked about very much. Why do you think that is? That's a great question. And off the top of my head, I cannot help but wonder about stigma. Because we're talking about our personality. We are talking about the makeup of who we are. And if the makeup of who we are is somehow problematic or causing issue for us, there might be a stigma against that. I think that they're not quite as well known because they're not as, you cut and dry, say, as perhaps the symptoms of depression, or say the symptoms of bipolar, where you have a set number of symptoms that you can treat specifically. With personality disorders, again, we're looking at personality traits that are problematic, that take much, much longer to treat, and probably are probably significantly frustrating for the person who is experiencing it. Let's see. Oh, here's a good one, actually, because I just answered this one, but I want to go into more detail. What is the cause of personality disorders? Can trauma trigger them? There is research being looked into that in terms of trauma being a trigger for personality disorders. And I think that if I had to guess, I'll give you an educated guess, is that the answer would be yes, that trauma can be a trigger. Because say these personality traits serve as a substrate to one's, well, personality. But some of these more maladaptive traits have not yet manifest. It may take something like a trauma to then serve as a catalyst to set these more maladaptive traits into action. I have heard that borderline personality disorder is often confused with bipolar disorder. Is this true? Yes, yes, it is. They could also be diagnosed together too. In fact, again, there's a comorbidity here that depression and borderline can be diagnosed together. Bipolar and borderline can be diagnosed together. I think one of the reasons why bipolar 1 and 2 and borderline personalities can be mistaken for one another is because of sort of the cyclicity of the moods that with bipolar you have the cycles of mania or hypomania and depression, but with borderline there's still this kind of uh, range of moodiness and instability that I think can be easily mistaken. So it's really important when working uh, to diagnose or when working with somebody, you have to really, I think people have to be very, very careful not to jump to a conclusion of one diagnosis or another. You have to get a really, really good history and watch how the behavior plays out. Are personality disorders often misdiagnosed because of symptoms that often overlap with other mental illnesses? How are they distinguished? And the answer is a resounding yes. I think that, at least in my experience, personality disorders are very hard to diagnose because you have to remember the personality traits that are maladaptive and are problematic, they need to be fixed. They need to be fixed over time. And um, a person can have depression for 20 years as well. But on the other hand, when you have personality traits, you'll begin to recognize after talking to someone that this is something that's been happening, you know, as their personality was developing, even before those 18 years, that maybe that there was something there. And so they are distinguished by, again, the sort of the length of time uh, that the personality traits, the maladaptive ones, have lasted, and much longer, say, than what we used to call Axis 1 diagnoses. I don't think the DSM, the Diagnostic and Statistical Manual of mental disorders, they don't diagnose those anymore in terms of calling them Axis 1, and then personality disorders was Axis 2, and medical disorders were Axis 3, and they don't do that anymore. Let's see if there's anything else here. Let's see. Here we go. We'll have two more here. How can we help a friend with a personality disorder? I would say support, support, support. Remember, these are ingrained traits that even though they cause the person typically a lot of turmoil and a lot of issue, there's no point in trying to change them because they're not going to change. If they want to change these traits about them that are causing them issues, of course, they'd have to go into some kind of therapy. But just be a loving, supportive, compassionate friend as best as you can be. And that's the best advice I could give on that one. And can medication be used for personality disorders? I'm sure that, I am not a psychiatrist, so I don't prescribe medication. That would be outside of my scope of practice. But I do know of people who have been prescribed medications for certain symptoms, to help stabilize them if they were in fact becoming unstable because of their personality disorder. And I think we're good. Well, I want to thank you very, very much for these enlightening questions and for listening to my talk on personality disorders. I look forward to talking to you folks next week, and have a wonderful week, and I'll see you then. This has been Tough Talk with Dr. Dana. Bye-bye.